Connecticut hospitals are preparing for what's to come with the coronavirus and the predicted influx of patients. And joining us now to talk about that is Hartford Healthcare President and CEO Jeff Flaks, who was also my guest on Face the State this past Sunday. Mr. Flaks, thank you for being with us here today.
Dennis, thank you.
You know, I know you represent Hartford Healthcare, but I was wondering, in terms of coordinating with all the hospitals in the state, how is that going, and what can you tell us about the overall situation in our state?
Yeah, this is a regional response. At times like this, this is an unprecedented set of circumstances. No one is representing their individual health system interests. This is about coming together, joining together. It's about doing the right thing. It's about doing the right thing for our community, for every patient that we're caring for. So I'm really delighted to see the type of collaboration that we're having. And truthfully, the partnership that we're having with state government, everyone is pulling in the right direction, in the same direction.
Governor Lamont just said that the number of people infected with COVID-19 will probably increase exponentially in the coming days. Do you have any ideas to how many patients will be in hospitals across the state with COVID-19 in, let's say, a week?
So all the hospitals across Connecticut are running different models today, and we're planning for really worst-case scenarios. And we're ensuring that we have the agility to adjust as circumstances demand that. So it's really impossible to know. But we need to be prepared for our health systems to double and triple in size, potentially, to care for the number of people who are in our community who will need our services. So it's really requiring us to think very differently, very creatively, and to use our people and our capabilities differently than we have ever before.
I want to touch on how you said creatively. Does that mean that we may have to use other buildings to assist these hospitals, maybe dorms or things like that, if we don't have enough rooms?
We've done tremendous planning. First, Dennis, we plan like this for mass casualty events. We plan for this for natural disasters and to an extent for pandemics. But we've never seen an event of this size and scope before, or at least certainly this risk. We do have within our plans the opportunities to collaborate and move to other facilities. And I can just tell you the sense of community in Connecticut is one of the things that makes our region so special. And one of the very real examples, I've been amazed at the support we've had from other businesses and from community leaders. And I'll tell you one really very true example that demonstrates this perhaps more than anything is our college, universities, and presidents have really stepped forward, and they've started to assess how their campuses could be part of the solution as we look to scale up our capabilities. So we're looking at buildings like that that have significant number of bed counts and that have the potential with food preparation and bathroom facilities and so forth to accommodate the type of care that we would need to deliver. So I'm confident as we go forward that we have different staging available. But we will have other challenges outside of the facilities, and those are namely our ability for staffing and to support the requirements to have the right people there to care for our patients safely, to be properly protected, and to have the supplies that we would need to care for people at the level that we're describing.
The governor just said that we don't have enough ventilators and equipment to handle the influx of all these coronavirus patients. Is that the case, and is there a place to get additional equipment from, or what would we do in terms of, would there ever have to be choices made between one sick patient and another? Who gets the ventilator?
First, this is one of those very good examples of collaboration. All the hospitals are working really in partnership today together to do this type of planning and to make good decisions. So we're working in a very aligned fashion, and we're working very well with the state and the state government, and particularly under Governor Lamont's leadership, which has really been outstanding in support of the hospitals during this time. So we are, I think, making progress. I think it's getting better every day in many places in terms of some of the key supplies that we need, and there are new sourcing that's being done to support us. But there are isolated examples in places where we've not yet had the success we need to that puts us under pressure. So it's a dynamic process, and it's managed really day by day. But I think we're making progress unquestionably.
There's a call out for retired doctors and nurses to come back in and help. What's the response been so far?
First of all, just to come back to the sense of community. We've had such support. We've had so many small businesses, large corporations, and individuals, people working to help us. Dennis, let me tell you a story that I found. I heard it today, and I found it to be remarkably touching, and I think it's indicative of the culture of our region. One of our staff members went to get gas for her car today, this morning, on her way to work. And she's one of our home care our staff members, a colleague of ours in home care. And she goes out to fill up her car in gas, and she hears some noise, and she looks up, and she realizes it's a person clapping, and she doesn't know why. And then all of a sudden, everyone around her, and it was fairly crowded at this point in time in terms of people getting gas, started clapping. And she realized she had her badge on. And she got a standing ovation at the gas station. And people came up to her after and said, "We thank you. We want to thank all of the nurses, all of the doctors who are taking care of the people that are sick and helping prevent us from getting sick." I mean, I found that to be so moving, and it's so indicative of the outpouring of support I see constantly all day long.
I love hearing that because that's just an amazing story. And the doctors and nurses and healthcare professionals are working really, really hard today. What is your message for the people out there who, because life goes on at the hospital, there are still people having babies right now. There are people coming in for chemotherapy. There are kids who are cutting their thumbs and need to get stitches. What do you tell the moms and dads here and other patients who are kind of worried about going into a hospital situation in this day and age with coronavirus out there?
First, let me tell you, I can't express enough. I don't think I could put it in words, quite frankly, for how profoundly just grateful I am and how inspired I am when I see the work that our teams are doing today across the entire state and beyond, but all people who work in healthcare. The way they're putting themselves forward during a time of crisis and rising to the occasion, the sacrifices they're making, the courage they're showing, it's really remarkable. It's remarkable. So what I tell people is the people who work in our organizations are working to ensure that everyone's being treated safely, that we're practicing all of the best practices, that we're putting every protection in place, and that we are there. And we're standing up our institutions. So for people today, and it does happen within our community, who need heart attack care, stroke care, trauma care, our institutions are standing strong. We're ready, and we're there to serve, and we're doing everything we possibly can. And it goes out to the people who work here. For me, 30,000 people who work in Hartford Healthcare, every one of those people, what they're doing now to maintain our services, ensure that we're preparing for what is, what will be, and what we can't even imagine, and at the same time ensuring we keep doing what we have to do, the core of what we do each and every day. It's just a tribute to incredible human beings who are doing this work.
Jeff Flaks, the President and CEO of Hartford Healthcare, we thank you so much. Always great to talk with you, sir.
Thank you, Dennis.
Thanks for coming on.